I am Meredith Hirsch, and this is Working Healthcare. But what's not working? We've told a whole generation of physicians that medicine is a calling, then handed them a business they were never taught to run. Burnout climbs, advocacy feels abstract, and too many doctors still think politics is something done to them, not by them. Today, we're talking about the fix hiding in plain sight, the physician family. My guest is Ginger Allen, a force behind the Florida Medical Association Alliance, part of a national network you might know as the American Medical Association Alliance. Think of the national group as the connective tissue, education, leadership training, a coast-to-coast community, and the state alliances as the muscle on the ground, doing the grassroots work, relationships, and local advocacy that actually moves policy and supports physician families. Here's the twist. Alliances were born in another era, when members were introduced as the wife of Dr. So-and-so. But women now make up the majority of U.S. medical students year after year. The identity has shifted. Physicians are partners, parents, leaders, and the alliance has to shift with it. Ginger stepped in when Florida's membership had dwindled to roughly a couple hundred from the heights in the many thousands because doctor's wife doesn't resonate anymore. She sees physicians suffering, including at home. Her husband is a VA radiologist, and she's rebuilding the alliance around what today's families actually need. How? By modernizing the structure and the money. She's pushing a conversation from a 501c4 to a 501c3, so corporate sponsors can support physician family programs and donors can take a tax deduction. Of course, she's hearing the 6 most expensive words in business. We've always done it that way, but she's undeterred because her one-liner is a challenge. Every physician should give $500 to their PAC. Why? Because the business of medicine is still a business. And if you're not at the table, you're on the menu. Plus, Ginger hosts the Functional and Integrative Medicine podcast for providers, where she spotlights root cause care and the innovators delivering it. Let's dig into how alliances get unstuck and how physician families can pull this profession forward. Ginger Allen, welcome to Working Healthcare.
Thank you, Meredith. I'm so excited to be here.
I am so excited. You're a podcast pro, so this is going to be easy for you.
Well, I'm usually on your side, so this will be interesting. I'm usually not on the interviewee side. So
I was going to say, you can ask me some questions if you have them. There you go. A quick snapshot. Sure. So I'd love to know, where did you grow up and what shaped you into wanting to be involved in the advocacy realm of medicine?
Great question. So I am an Army brat. My dad was a major in the Army, so I've lived all over the world. My mom's originally from Montreal, Quebec, so I've lived in Canada. I was born in Germany. I've lived in many states. I think we moved on average every 2 years. So, I'm kind of a worldly kid. And when I was younger, my parents did divorce when I was about 14 years old, when I was a teenager. And my mom then became a single mom of 3 girls, I being the oldest of 3 girls. And I used to bring home all of the homeless kids. And my mom used to say to me, I'm a single mom with 3 kids. Why are you bringing home more children to take care of? She's like, what are you, Mother Teresa? And jokingly now, my mom's now 85. And as you probably are dealing with, working with elderly parents is challenging. And she now calls me Mother Superior because she says that the dynamic has shifted. I'm no longer Mother Teresa to her. I'm Mother Superior. But I am still truly a philanthropist at heart. I really like helping the underserved, the people in need. And I feel that when you've been blessed with more, that you should give back and help others.
So what did you study in school? How did you get into what you do now? Because I know you have your own separate business. You have your podcast. You're involved in all of the advocacy, specifically in Florida. And you and I joked, but we were both dead serious that 2026 is going to be the year of saying no as opposed to the year of saying yes. So what brought you into this realm?
Yeah. So I moved to Nevada in 2012 because I met a guy who happened to be a physician who lived in Nevada. I was in Florida. And he convinced me to move to Las Vegas. And so I moved out to Las Vegas for my now husband. At the time, we were, just boyfriend, girlfriend. And I moved out there, and then we got engaged. And I ended up getting a job doing marketing for a radiology group, coincidentally. I've always been in marketing and sales. I went to school, but I didn't finish college because the only thing I enjoyed was psychology, and I'm an empath, so I couldn't be a psychologist. So I decided I was going to be an entrepreneur. So I'm a serial entrepreneur, but at the time when I moved to Vegas, I didn't know what I wanted to do, and I had left Florida. I had a real estate mortgage and title company. The market was still very flat at that time. And I was like, I don't really want to go back into real estate. What can I do? And, my husband at the time jokingly said, why don't you get a job? And I was like working for somebody? And he was like, yeah. And I was like, okay. So I went looking for a job, and I found a job doing marketing, business development, physician liaison work for a radiology group. And so I started working for them. And then as I started to get to know the medical community, one day a gal walked up to me and she's like, aren't you engaged to a physician? And I said, yeah. She's like, oh, you should come to our lunch. And I said, what lunch are you talking about? And she said, oh, it's the Clark County Medical Society Alliance, the Spouses of Physicians group. And I looked at her and I was like, I'm not sure. Let me think about that. And at that time, my idea, and this is probably what the general public thinks too, was that physician wives are the type of people that just spend the day at the spa and play tennis.
Like, people ask me all of the time, they're like, really, you work in the office? These are obviously people who don't know me. Do you work for your husband? And so sometimes I joke a little bit and say, well, I really just go into the office for the high-speed Wi-Fi so I can order more shoes. Because
right.
what do I work in the office? I'm like, this is a company we built together. But I think that is an old school mentality.
Absolutely. And back in the, before women worked, I mean, obviously, if you were married to a physician and, women weren't working, the physician wives probably did have a little bit of a cushier time than the everyday woman. But regardless, this was my vision of what a physician spouse was. So I went back to the lady and I said, it's probably not going to be for me. We married late in life. We didn't get together when he was in med school. Like, I didn't go that whole residency track and all that you guys all went through. And she's like, well, I tell you what, come to lunch. No obligation. If you don't like it, you don't have to come back. I was like, oh, what do I have to lose? So I go to this lunch, and it's a big room with a lot of women, and I sit down at a table, and the first woman I meet happened to be a lady named Jacqueline, and I was like, hi, nice to meet you. What do you do? And she's like, oh, I'm an attorney, and I have 3 children. And I'm like, oh, nice to meet you. And then the next lady, she's like, hi, I'm Karen. I'm a nurse, and I have 4 kids. And the next lady, was an accountant, and they were all professionals. So I was like, oh my gosh, okay, maybe this is my group.
Right, they aren't the wives who are staying at home and going into the office to buy shoes with high-speed Wi-Fi.
I mean, there was probably a minority of women that, were, and I like to say, professional moms, like they actually get to stay home and raise their children, which I think is the hardest job in the world, by the way, is being a mom. My mom used to always jokingly tell me, moms are 365, 7 days a week with no vacation. Mm-hmm. And so to me, I think that's great if you can be a professional mom and be home with your children. But these women were not just being moms, they were also having professions. And so I was super uber impressed, and I immediately joined the organization. And I remember Jacqueline saying to me, oh, you're going to be on the board, and we're going to put you in leadership. And I was like, oh, no. That is not me, Jacqueline. That is not me. I'll support you. I'll donate money. I'll come to the events. I'll do everything, but I am not leadership material. I said, I didn't go to college. And she's like, what does that have to do with anything? And I'm like, well, I'm an entrepreneur. I'm not really, I'm not like you guys, with all your fancy degrees. And she's like, so what? She's like, you're going to do this. And she just like basically said, you will be the vice president of membership next year. And I was like, okay. And then, fast forward, then I ended up becoming co-president. We ended up raising, $150,000 for mental health first aid training for public schools in Clark County for kids. So kids could learn, what bipolar is, what depression is, how to handle it if a kid's suicidal. And so we brought this really important training. And I was just so passionate about the philanthropy that these women were doing, and all the great, advocacy. And I fell in love with it. And ended up, becoming a lifer. And then 4 years ago, my husband got transferred to the Miami VA, which is coming back home for me. So I was super excited. And the first thing I did, I was like, okay, where's my Florida ladies? And so I connected with the Florida Alliance, and they were like, great, you're going to be in leadership. And I was like, no. I'm taking a 5-year hiatus from a board position. I'm very, I need to get my business going down here. I've got a lot going on. And they're like, no, we really need you. Like, we don't have, a lot of people to take over leadership roles. And then I was like, okay. And so now I am the president of the Florida Medical Association Alliance, and very proud to be. And, and I really want to help our organization. We're coming up on celebrating 100 years this year. And I want to really get us positioned for the next 100.
And it's not all women.
No, well, now we're having men. Back in the day, there was no men, but now we actually have a male president. The American Medical Association Alliance just installed their first male president in the history of the organization. So we have a lot more women in medicine. So now we're getting a lot more men in our organization. So
100 years, we're looking at 1925. What was the organization like back then? Because I know you've seen the membership rolls and you've seen these numbers into the thousands. And when you came on board, there were only 200 members part of the Florida Medical Association Alliance. And I'll tell you, Ginger, I've been involved with the FMA, but never on the Alliance side. And you and I just recently connected. So I'd love to hear about the history of what it was like at its height, and what you're trying to do to change it and bring it back.
Yeah. So the organization was established in 1926. And when I go back and look at 1926, because we're getting ready to celebrate our 100 years, the women on the roster didn't even have their first name. It was Mrs. Charles Brown, MD, right? They didn't even identify with their own names. And then I think that started to probably change in the 60s, after the 50s. Women started to become, identify with their own names. But from day one, these women were doing amazing work. I mean, they were doing so much charity work, so much advocacy. They used to be really involved at the political level, like going, to Tallahassee and, getting in there and fighting for physician rights and fighting for, reimbursement increases or whatever the case might be. They are, I believe, and don't quote me, I should have brought probably these stats and with me, but, they were very instrumental in getting smoking banned in all public places in Florida. They, have done, I think it's called SAVE, which was, the anti-bullying campaign. They've done so many amazing campaigns over the years, and we have like a list of them. I'm just looking at all the accomplishments, and most of it is for the community, like helping our community, with things that they need, and also supporting other nonprofits like, the St. Jude's and the Alzheimer's associations and the cancer associations. They've supported those as well along the way. It's just amazing to see the work that they've done over the years, and they really don't get enough credit.
So why do you think the membership dropped down to such a low number, and then you stepped in and you're working to create change?
Well, I know why it happened. I think, and don't quote me again, I didn't bring my actual stats with me today.
I expected you to bring like loads of paperwork, Ginger.
I know, right? I wasn't thinking about it.
I'm teasing.
20 years ago, I heard a stat that we had 20,000 members, and I think that was, maybe even in the state of Florida. And I think, 20 years ago when more women were professional moms, they had more time, right? They had more time to give back to nonprofit life and to supporting these philanthropic causes. And fast forward 20 years later, not only are women working full time and raising their kids and taking care of the home and taking care of the pets and taking care of our elderly parents, they're also being torn in 20 million different directions, right? So they've got the PTA, they've got the Jewish Federation, they've got the St. Jude, they've got, back in 20 years ago, there was only a few different nonprofits that were vying for their attention or for their support. So now I have to compete. My organization has to compete against all these other nonprofits. And then, of course, the millennials, I think they want to get involved, but they're very philanthropy focused. They're not just, I just want to be a member to be a member. They really want to make change. And so they expect that when they come into an organization that there's going to be major change. They're a part of major change. And I think, we lost that for a little while in the sense that there just wasn't enough manpower anymore because women were so busy doing everything else that we just didn't have the bandwidth to support these organizations the way they used to be supported. I mean, we used to have staff. We used to have a budget that was given to us by the FMA that would support us in our causes. That ended up going away, and so we lost all of our support systems, and so now I'm coming in to kind of try to rebuild it.
What is the breakdown of women versus men in the FMAA now?
Oh, probably 10% men.
Okay, because so it's still really low.
Yeah. And so, I'm talking to the women physicians and I'm saying, I'd love for your spouse to be, involved and support us. But again, this is kind of outside of their normal genre too, right? The men are, they're also helping with the kids now. They also have their own careers and they're kind of like, well, what do you mean you want me to be a part of this Spouses of Physicians organization? Like that's just, there are men groups like, that are specific for male physicians, male spouses of physicians groups, but they're few and far between. I think the largest one does have a couple thousand members, or maybe it's a nationwide organization. But so it's still small, but it's growing.
It's interesting that you say that millennials really want to get involved and be active. I'm actually not finding that so much. We had the baby boomer generation who grew up with the advocacy, grew up with bringing feminism into the light, right? They were fighting for, with Vietnam and against Vietnam, and they were on the streets, and this was JFK, and this was Martin Luther King, and this was during all of the greats who were trying to create reform. And so this baby boomer generation became a part of that change, right? And then we, Gen Xers, came in and were like, you know what? We felt empowered. We were the first generation to grow up actually without racism, or not racism, I should say, without segregation. And we were also the first generation who we saw our moms work. We were in dual families. We had a very large divorce rate going on when we were growing up. I mean, I was a latchkey kid, and I did want to get involved, and I did want to try to create change, and I did want to see what was going on in policy. And you get the millennials who I don't know if they're willing to get as involved as their predecessors. Okay. So I don't know if that creates a change as well or decreases the membership, because even when we look at the FMA, and I don't know the numbers,
right,
but
their numbers are down too.
Yeah. So they're not getting involved in advocacy or getting involved with organized medicine.
So let me rephrase. So what I love about the millennials is they're all about working smarter and not harder. And I love that about them because they're like, we will support this, but you have to make it easy for us. Meaning we need the structure, we need the guidelines, we need everything handed to us on a silver platter. We'll donate the money. We'll invite our friends. We'll become a part of, but we're not going to become a part of some, disaster where we got to actually roll up our sleeves and get dirty because, quite frankly, we don't have the time. And I think that's very smart if you think about it, because you and I, the X generation, we are horrible about setting boundaries. We don't know how to say no, right? And so I'm like running a business full time. I'm taking care of my mom, who's 85. I'm running this nonprofit organization. I've got 20 employees. I mean, I'm pulling an 8 to 8 today. Do you know what that means? I'm going from 8 in the morning until 8 o'clock tonight with no breaks and a protein bar. Okay. So the Xers, the millennials look at us and they're like, what you guys doing?
Right.
Like,
I think
come on, you need to set some boundaries, girl. So we don't know how to set boundaries because we were always taught, no, you say yes, you roll up your sleeves, you do what you need to do to get the job done. And so I don't think it's that the millennials don't want to support us. They do, but they don't want to be in chaos. They don't want to be in disorganization. They don't want to, it's not even that they don't want to. They don't have the bandwidth. These women are, I'll say, smarter than me in the sense that they are going to say no, and they're going to put their family first. They're going to make sure that they're at home for dinner with their kids. My mom, a lot of times I put the dinner on the table. You know what I mean? It was me and my mom together as a team.
Ginger, don't you think that teaches resilience? Don't you think that teaches problem solving?
It does.
The go-get-'em attitude?
It does. But it also comes with burnout. It also comes with a lot of stress. It also comes with health-related side effects that a lot of, women in their 50s, our women our age are getting sick. And, I don't know if you've looked at women our age lately, but they don't look that healthy. I mean, most of them aren't going to the gym and taking care of their health because they don't have the time. They've given too much of themselves.
You forgot that we live in Boca Raton. So
okay, maybe in Boca that doesn't apply, but look around the rest of the country. Women just don't have in our generation, they don't have the time for themselves. And then on top of that, their kids are now having kids and now they're being grandparents on top of everything else.
Yeah, but didn't that always happen? Didn't that happen to the previous generation with the baby boomers? Yeah. Isn't that just potentially the cycle of life?
It is, but the millennials, like I said, they're about working smarter, not harder. If they can find a computer app to get it done, or if they can find a computer system or a software or an AI tool to make things more efficient, they're going to do it. And if they look at an organization that is using Excel spreadsheets and black books, they're out. They are not interested.
So what are you doing to create the momentum, to create the change? I know that you're going from, you're changing actually the status of the organization at the FMA.
Yeah, we're working on that. It hasn't been ratified yet by the membership, but it is coming up at the annual meeting for the vote. So I'm hoping that the members will support what we're trying to do. So we're trying to make it a more nimble organization. We're trying to make it more, technology. We're systemizing everything, trying to make it, again. So I'll give an example. So when I was with the CCMSA in Clark County in Nevada, we were old school. We were binders, and one binder would go to the next president and the next president and the next president. And I took a look at that and I'm like, oh, heck no. I am not doing that. So I created a Google Drive. I automated everything. I got an app for, instead of a directory, which we would print in a book, I created an app for our membership directory. I set up the Google Drive. I got us a membership platform, a software system to run the membership instead of us doing it manually. And a lot of people were really resistant. They were like, oh my God, what are you doing? We're not going to have to find anything. I said, no, trust me. This is going to be much better. But I got some resistance. But I really, was adamant about that, and I pushed for it. And it was funny. It was probably this last year. So 5 years later, I got a text one day from the current president, and she was like, I just wanted to thank you. And I said, for what? And she's like, for all the work that you did to make my job so easy. And I'm like, thank you so much. It took 5 years for somebody to really realize everything that we had done. And it wasn't just me, it was my whole board. It was a group effort of all of us doing that to get that job done. But I was leading the charge. And, to have the millennials now really appreciating it and hearing the stories of, before Ginger was president, we had a black book and, we worked out of a binder. It just really makes a big difference with this generation.
What's the difference of a 501c4 versus a 501c3? How will that make you more nimble?
So we've always had both. So we have the C4, which is our current organization, which is the FMAA, and then we have the C3, which is the FMAA Foundation. And the difference between the two is that a C4, you cannot write off the donation. So your donors cannot get a write-off for that. They're still supporting the organization, but it's not a tax write-off. The other thing with the C4 is you can be more, do more advocacy at the legislative level. For example, you can endorse a candidate and get behind them and, throw a fundraiser for them if you wanted. A C3, you can't. So that's a traditional nonprofit where you can write things off, but you can do advocacy and education, but you cannot endorse candidates. So there's a fine line where the advocacy, meets there. And so what we're kind of doing is we're merging the two organizations and kind of consolidating everything into the C3 so that we can, get the sponsor donations. And, for the people that are super excited about politics and they really want to, advocate, in Tallahassee, they are obviously, prefer to keep the C4, but there's just, there's not enough people getting on planes going up to Tallahassee, in my opinion, to make it worth it keeping that designation, if that makes sense.
In our area, just to let you know, they just got rid of the flight that goes from Fort Lauderdale to Tallahassee.
They didn't.
Yes, and now we have to go to Miami. And I'm literally debating, because I have to go up there in December, going, okay, so I could drive there in 7 hours, or I could spend an hour and a half driving down to Miami, and then I have to, it's in Timbuktu at the Miami airport.
2 hours and waiting for the plane.
Yep,
and then an hour.
Fly up. And then take
rent a car.
Uber, and take an Uber over to the hotel.
It's going to be 7 hours either way.
Exactly. So I'm trying to figure that out.
Yeah.
If you figure that out, let me know.
I'll let you know. So I am working with the FMA and, their board to get us more involved in the advocacy, because it is important. We need to be involved. Like I said, to you, you coined the phrase that I like to say, which is that, all doctors should donate $500 a year minimum to their med pack, because they really need to represent themselves. The insurance companies are just burying us. And, and I learned that not through the alliance, but through my company. So my company is your medical liaison. I've been, after I got out of working in that marketing company, doing marketing for Radiology Group, I started my own company doing marketing for physicians. And so I've been marketing for physicians now for 11 years. And it's through my business that I learned the physicians are really struggling financially. They're struggling to, with how they run their business. They're struggling with the, how the insurance companies are requiring them to take notes and how many patients they have to see a day. And it's just been heartbreaking to watch them struggle as much as they have these last 11 years. And, I did a little research last night, and, physicians have not had a Medicare reimbursement in over 2 decades.
Yep, since 2000. It's insane.
And how can politicians, I know that the insurance companies are spending millions of dollars to support politicians, but when it comes to you or your family member getting sick, is it the politician that's going to take care of you? I don't think so.
Yeah, but golden rule. You know the golden rule, Ginger. The one with the gold makes the rules.
Right.
And that's exactly why you want everyone to contribute $500, because that is part of their association, that the Organized Medicine Association is the one looking at the greater good of physicians and still focusing on trying to get our best and brightest to medical school, because right now we're training them to go trade money on Wall Street.
Right. But, the problem that I foresee with that is that the insurance companies are so far ahead. And the policies are so stacked against physicians now that, in my opinion, just based on, my layman outlook on what things look like, I would say within 10 to 15 years, there will not be any private physicians left. They'll all be in capitated government insurance run groups. And that's scary, because these insurance companies, they make these doctors see 50 patients a day. And how can you see 50 patients a day and really help people? And that's how I got into the functional and integrative medicine, because a lot of doctors are going concierge now to survive. And I'm all for it, because they're able to give better care. They can spend an hour with a patient. They can really help patients heal. And now I'm seeing doctors are going back and educating themselves now on functional and integrative medicine, which is, healing the root cause. And these practices are thriving. But I still want our general surgeons and our orthopedic surgeons and our primary care doctors to be able to be independent. And I just don't know how they're going to be able to do that if something doesn't change.
So if this is inevitable, why do we need alliances? Why should we get people involved into medical societies?
Well, first of all, organized medicine is not just the political side, it's the family of medicine. And if you are the spouse of a physician, you know how lonely that life can be. And so being a part of organized medicine from the physician spouse side anyway is about supporting, other families that are going down the same road that you're going through, dealing with the same stresses that you are going through, understanding what this life is like. Because I think, as we know, the general public thinks that we're all rich. And, I haven't really met a really rich physician in a long time. I'm not saying they don't make decent livings, but I haven't seen, multi-millionaires in my 11 years of working with physicians. So, there is a lot of hardship in the physician family life. And I think we support each other in that. We also need to continue, I think, the fight for organized medicine for us to maintain private practice, because I do believe that once the politicians themselves and their families start going to these capitated programs where they get to spend 10 minutes with their doctor and they haven't even finished what they're saying and the doctor's out the door, and they're going to be like, oh my God, this is not the kind of physician I want, then eventually we will have to go back to the old way of and this is what we're seeing in concierge medicine. This is the old way of practicing medicine, is you actually spend time with the patient. You actually work on finding out what is really wrong with them and healing that so that they can get better, not just giving them the prescription and walking out the door, which is what they're being forced to do. I've never met a physician that doesn't really want to help patients. They are unable to because they are not allotted enough time to actually do the work.
Or they're being handcuffed because of the regulations and the rules that insurance
Correct.
companies are dictating on them. But I'm seeing a shift, and I'm actually really excited about that. I'm actually seeing doctors leaving the hospital and leaving larger institutions and trying to make it out on their own.
They are, and I'm doing a lot of their marketing. And I just had a doctor do that recently, and he's 65 years old. And I was like, are you kidding me? I'm like, you're leaving your salary and the hospital and all of the benefits that come with that to start your own private practice. And he's like, they just don't care about me. And he's like, and he was going through some health stuff himself, and they just didn't even, give him any, support through that. And he was like, I'm done. And he's like, I'll make less and, enjoy what I have left. And he loves medicine. I mean, he's just started a practice at 65. Who does that? But I see that too. Yeah. And I love to see that. So I want, I do believe that we will have to go back to this way of medicine. I do believe that the current model will break because it's not working and it's not sustainable. And eventually people are going to demand that we fix the system, and they're going to demand that doctors get the reimbursements increases that they deserve, at least cost of living increases. I mean, this isn't crazy what's going on.
And I think we need a collective group that has the same voice, and we are working with our politicians and working with those decision makers to share what is hurting us as doctors. And I say us, you and I are not doctors, but we work in the healthcare world. But what is hurting those clinicians the most? And that's what I hear time and time again when I speak with members of Congress or when I speak with our state legislators. They say, you know what? The biggest challenge is I have surgeons coming and cardiologists coming and rheumatologists coming and internists coming, and they're all sharing so much different information, and they're not focused on 3 key points. I would really like to know, what are the 3 areas that is wanted or needed most according to physicians as a whole, which I'll get back to. And I think the MA AMA went rogue for a little while, and I'm hoping they're coming back. I've heard that they're coming back.
I love the new president, yes, and he's very supportive of physician spouses. I was just I'm on a national committee for the AMAA, and they were just so happy with this new president, and he really cares about physician families. And I will tell you, what affects the physician affects the family.
Of course it does.
And that's why it's so important for us to stay involved, because if our spouses are burnt out, if our spouses are, physician suicide has been, a huge problem that we've been dealing with. If our spouses are burnt out, it affects us. We're burnt out too. I mean, it's very hard on the family. I've heard physicians. One of our members did her PhD thesis on physician burnout and how it affects the physician spouse and the family. And I've talked to spouses that their kids think that it's normal to go to the hospital to say goodnight to their dad. They think that that's what all kids do. They go to the hospital to say goodnight to their dad. I always like to say, people don't really understand, and I didn't understand this either, the amount of pressure and how difficult being a physician is. And it's not just about the seeing how many patients they see every day and all of that. The biggest stressor, I think, is that they're not allowed to make mistakes. Mm-hmm. I always say to my team, if we don't get the logo out today, the client's going to be upset, but nobody died. But you know what? When my husband makes a mistake, people die. That's a lot of pressure on a human being. And they crack under that pressure. And without the necessary time off, without and I'll add, and physicians are not allowed to get seek mental health. They're not allowed to go to a therapist. They're not allowed to get medications, because then their license is online. We're trying to change that. We're trying to make mental health for physicians accessible and stop those laws that prevent physicians from getting help. But this is the system that was created, is that they have to be perfect all the time. They can't make mistakes. They certainly can't have a mental health issue. And so now, these guys and gals are just cracking under this pressure. And who suffers and who takes care of them when they come home is us.
So give me your playbook for rebuilding membership. What are you saying to our listeners or those who are part of the Alliance community? How can we rebuild membership?
So membership organizations as a whole are on the decline. And that's not just with organizations like ours, but also professional organizations. We're not what I would call a professional organization, right? We're not all professional. We're not all in the same profession. We're not giving CMEs. We're not giving discounts on your insurance. We're more of a family, supporting one another through a journey. And we're doing philanthropy and we're doing advocacy, but we're not a professional organization. But even the professional organizations are on decline because millennials can go now to LinkedIn, to, free, anything on the internet that they can find, free groups that support the same, causes and not have to be a member. So I'm leaning towards, looking more for supporters and getting away from this, you have to be a member, and let's be supporters of organized medicine. Let's be supporters of our alliances. Let's be supporters of the AMA. Let's be supporters of our PAC. What does that mean? It means we cut checks. It means we roll up our sleeves. It means we get involved. And I think that, that's going to be probably the future that we'll need to change to.
And how do we get people involved? What are you doing? I met you actually at the Palm Beach County Medical Society Women in Medicine event, and you must be involved in these types of organizations throughout the state, even though you live locally.
Yes.
What are you doing to spread the word?
So I'm going to all those events, right? So I'm going to all of the society events. I'm staying involved at the national level. I'm involved at the state level. I'm trying to support the FMA in any way that we can. I went to their annual meeting. All of the galas, I pay my ticket and I go and I try to meet as many spouses as I can, and I ask them to support us.
So I want to ask you, with everything going on in our American healthcare system and in our Florida healthcare system, because you and I live in Florida, if you could create one change within our American healthcare system, what would it be? What would fix what we're dealing with right now?
we need the politicians to support private practice and stop leaning so heavily on supporting corporate medicine and insurance medicine. We need them to see the value in the private practice. We need them to, and unfortunately, they're going to have to suffer the pain of what it's like to go to a physician that is not a private practice physician before they're going to realize it. But I hope that they're starting to see it because they're seeing it in their parents. I'm sure you've seen it in your parents when you take your parents to the doctor. They're seeing it now. So I hope that it's not too late for them to really, realize that, this is not about the money. This is about your health, and money cannot buy your health.
It can't, but I think if we in healthcare were actually paid a rate similar to what those are getting paid who are trading money on Wall Street, who are working for these insurance companies, we could get perhaps a different, I don't want to say a different caliber of person. I would say more of a yearning to want to be within our healthcare world. My father's a doctor and my mother's a social worker. There was a reason why my dad went to medical school and my brother went to medical school and my husband went to medical school, and they were at the top of their classes. That's not necessarily what's happening anymore. And I'm actually in an upcoming podcast, I have the very discussion with somebody who was in that role and also chose not to go into medicine. She still wants to create a change within our American healthcare system. But how do you do that? You're obviously doing it. You're not in exam rooms taking care of patients, but you're working to create change as part of the alliance.
Right, because I realize how important physicians are to society as a whole. I mean, they play a major role. And I will tell you that I've been with a physician for 13 years. I've been working for physicians for 11 years. 98% of the people that I meet went into medicine because they really want to help people. Mm-hmm. They really care. They did not go into it for the money. There's a small percentage of people that went into it for the money, but a lot of those people went and got their MBAs and went and did a business.
But they also went into medicine not expecting that they would have $300,000 in medical school debt when they graduated.
Right.
So we have to figure out, how do we compensate physicians well enough or offer free medical school so that these physicians aren't spending 13 years, by the way, for rheumatology, okay? Yeah. Post high school, 13 years. And then you have $300,000 in medical school debt. So it's this delayed gratification and the constant stress of, I've delayed having children. I've delayed potentially getting married. I've delayed my career. I've delayed my savings into my 401k or any other opportunity for my retirement. And I have this debt, this school debt that continues to accumulate.
Right. Yeah, it's really, like I said, most people go into medicine because they really care about helping people. This is not a job for the faint of heart. It's a very difficult profession, both emotionally, physically, the training that they go through, the 100 hours a week that they make them work in school. They put, I don't even know how, and I asked my husband, I said, didn't you ever want to quit? And he's like, when you were in med school, he's like, every day.
Yeah.
But I never did because, he really wanted to help people. And so I think that we have to make it worth their while. If you're going to spend this type of time and energy and effort educating yourself, you need to be able to make a decent living. You need to be able to pay your debt back quickly, and you need to be able to support your family. And they're struggling to do that now. Especially private practice primary care physicians, they're making less than $100,000 a year.
Oh yeah, look at pediatricians; it's even lower.
Yeah. And so, with all their malpractice insurance and their overhead, so why would you have that much of a stressful job and have to give your life to a career that you could make the same money and be a flight attendant? I mean, you could do a million other things. You don't need to be a doctor to make that kind of money.
Yeah. Ginger Allen, I really appreciate your input, and I thank you for being on Working Healthcare.
Oh, it's been fun. Thank you so much for having me.
To everyone listening, the full video of this episode is now on YouTube. Search Working Healthcare and hit subscribe so you don't miss future interviews, short clips, and behind-the-scenes moments. Got a question, an episode idea, or somebody you think I should interview? Drop me a line at meredithhirsch.com. If this conversation hit home or made you think a little differently, don't keep it to yourself. Share the episode, tag a friend, or post it on social media. You can follow Working Healthcare on Instagram, Facebook, and YouTube, and connect with me on LinkedIn. That's where we keep the conversations going in between episodes. The more voices we bring into this space, the more momentum we build. New episodes drop every Tuesday. Subscribe and don't miss what's next, because you can't fix the American healthcare system if you don't understand how it works. Tune in weekly with me as we explore the inner workings of healthcare.
You got me running, got me running.